It's not a problem, Dr. Ranjita. Anyhow, some of the station can be unknown for anyone at any point of time. So you can attempt with your basic template. Don't worry. All the
Oh,
best.
okay. Okay, ma'am. Sure. Thank you.
If you don't, even if you don't know much about this task, you can simply think that is a antenatal task and then you can attempt.
Sure, ma'am. Fine.
Your time is up.
Okay. Hello, I'm Dr. Anjita, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Hi, doctor. I'm Amanda Jones and I'm 28-year-old.
Okay. How would you like to be addressed as?
Amanda would be fine.
Okay. Amanda, I see that you're through 15 weeks into your first pregnancy and you're here to discuss your blood reports. Is that correct?
Yes, doctor. Like, as you can see, I'm 15 weeks pregnant. I'm really worried about this reports because I just came into contact with the person and that's why I'm worried.
Okay, your concerns are absolutely valid, and please be reassured that we are here to support you. Would it be okay if I ask you a few questions to know your condition better before I discuss your blood reports? Would it be okay?
Yes, doctor, you can proceed.
Okay, may I know your concerns and expectations from this consultation?
Nothing in particular, doctor. I'm having this, like, I got exposed to a person who is having the CMV infection in school. That's why I'm
Mm-hmm.
worried whether I'll get the infection or if my baby gets the infection. And that's why I went to the GP and he did some tests, and now I'm here to discuss about the same.
Sure, I'll be discussing your concerns. And at the moment, how are you feeling? You have any fever, any tiredness?
Yes, doctor. Since yesterday night, I'm having some mild fever, but it's not too severe, I guess.
Mm-hmm. So, can you tell me about this exposure? Like, when did you have this exposure, and what do you do for living?
So I work at a school. I'm a teacher, and
Mm-hmm.
one of my students was having this infection, and he fell sick.
Mm-hmm.
And before he got diagnosed with CMV, I was having some contact with the student, like I was teaching them.
Mm-hmm.
So once he got diagnosed with this infection, I got worried because I'm pregnant and I've read a lot of things about this infection, and so I got myself tested.
Mm-hmm.
Now I'm having some mild fever, doctor.
Okay. So, have you noticed any swelling around your neck? Any tiredness? Any body pains?
Yeah, I do have mild body pains, but no swelling around my neck.
Mm-hmm. How is your pregnancy so far?
My pregnancy is good, doctor. So far, I don't have much complications apart from nausea, bit of nausea in the beginning, but now it got settled.
Okay. So, you have any other medical conditions you're seeing your GP?
No,
Any surgeries in the past?
no,
No. Are you allergic to any medications?
not that I know of.
May I know your blood group?
It's A negative.
Mm-hmm. Okay. What's your husband's partner's blood group, Amanda?
It's positive.
Mm-hmm. May I know your height to weight ratio?
It's 24.
Mm-hmm. Don't mind me asking, like, do you smoke or take alcohol?
No, doctor.
Mm-hmm. Any element of any recreational drugs?
No.
Okay. Any family history of concern, Amanda?
No, doctor.
Okay. So, any previously, like, you got any CME infection? Are you aware of this fever, CME infection?
No, I never got
Uh,
that infection.
So, how is your partner? Is he supportive?
Yes, doctor. He's very supportive.
Okay. How is your mood over the past week and months? Do you feel any anxiety, depression?
Not really. Just this from the past couple of days, I'm worried about this infection. That's it. Nothing more than that.
Okay. Thanks for sharing all the information. Do you want to add any further information, Amanda?
No, doctor. That's everything.
Okay. So coming to your concerns, I have your blood reports with me.
Mm-hmm.
You want someone to be with you while I discuss the reports? You like I can ask my nurse to be with you when I discuss. I mean, like,
It's
yeah.
okay, doctor. You can proceed. I'm fine.
Okay. Um. So this I have your report. It says that CMV IgM is positive. So, do you know
Good.
anything about CMV infection, Amanda?
I know this is a bit of viral infection which will cause some fever and body aches. And
Mm-hmm.
what do you mean by IgM positive, doctor? Does that mean I'm having the infection?
Amanda, this IgM positive, it says that it's a recent infection, so we need to do a further confirmatory test,
Mm-hmm.
so which is called avidity test
Okay.
to just yeah.
So as such, am I still having the infection, or is it a possibility that I cannot have the infection also?
So that we have to confirm with the further testing. So IgM positive status usually states that it's a recent infection. And to confirm the viral load and to confirm this, we have to do a avidity test. So further testing your, you know, antibodies. Uh,
Okay.
okay, yeah. So I'll put you in touch with um, the fetal medicine consultant as well.
Mm-hmm.
Um,
And
and
what if it is positive, doctor, that you were talking about some avidity testing? And what
hmm,
happens if it is positive? Does it going to spread to my baby?
yes, if it is positive, with your permission, can I view your booking blood test? Any test was done during your booking?
Yes, doctor. There is some basic booking blood test, and all of them were normal.
Mm-hmm. Okay, so CME infection, it causes certain infection in babies. Mainly, it causes some uh, uh, problems with the brain development. With here, sometimes it can cause some hearing problems and seizures in the baby. So it's very important that we have to see and check this infection and. If there is an infection, we will start you with the medication which is called valcyclovir to reduce this infection can pass on to your baby. So we call this as vertical transmission, and we can do one more test, which the fluid around the baby is taken for testing, which is called CMV PCR testing. Okay, I'll be referring you to fetal medicine unit.
Okay,
Am I
doctor.
clear, Amanda?
Yes, doctor, but it seems a lot I have to go through in this pregnancy.
Mm-hmm. I understand that like it's very stressing. Um, but please be reassured, we are here to support you, and
Doctor.
mm,
So,
we'll,
how are
mm,
we going to proceed, doctor? Like you mentioned that you're going to start me on a medicine and then some PCR testing.
yeah, yes.
And how are you going to manage further?
So first we'll get one more test. This is avidity test.
Mm-hmm.
And then if the infection is proven, we can start with the medication and check for baby's testing also. That is fluid around the baby. And if the test is negative, if no infection, we can discontinue the medication. And we'll monitor the baby growth, all that with the serial
Yes.
um, scans.
Mm-hmm.
Okay.
Okay, doctor. So,
Mhm.
does this medicine stop the infection from going to the baby or?
Yes, almost with 70%, it reduces the transmission, and you'll be cared by a team of doctors, my fetal medicine consultant, scan doctor, and my consultant. Okay?
Okay.
Yes. So,
And yes, you were telling something?
mm,
And I'm
That
planning to have another baby soon, doctor. Like after this pregnancy, if the baby is well and good, or in case if the baby is affected with CMV, can I plan my pregnancy after this?
Actually, after this infection, it's better that you wait for 1 year to
Mm-hmm.
start your plan your second pregnancy, because this infection uh, will this will this will be in your blood for a longer time. So this can affect the second baby. If you plan your pregnancy very early, this can pass on to the baby. So as I previously told you, it can cause some, problems in the brain development, hearing problem, and eye problem, all those things.
Okay.
Yes.
Okay, doctor. Can I breastfeed my baby?
Yes, you can breastfeed the baby. There is no concerns in the concerns to breastfeeding is safe in the CMV infection.
Okay. Thank you, doctor.
Yeah.
Time up.
Okay, ma'am, I don't know. Something I recalled and I told.
No, you have covered like most of the things. You told that you don't know anything about the task, but you covered almost
No,
80% of the things.
this one, I was
Hello?
in confusion. Yeah, ma'am. This I was in a confusion. This IgM positive is we have to do further testing. This is a recent infection. Only that much I can remember.
Yeah, I'll explain that to you. Yes,
Hello, Dr. Lakshmi.
yes,
Hello.
yes, yes, doctor.
Hello, okay. Can I tell you just
Yes,
hello?
yes, yes,
So if it is IgM positive means we have to check for the IgG also.
yes,
So if it is IgG, it's negative means we have to wait till 3 to 4 weeks, and again we will do the again IgM.
yeah.
If it is only IgM at that time also, if it is IgM positive, then it's not a CMV infection, maybe false positive report.
Yes, absolutely. So,
Okay, then if it is IgM, now it's came positive, then we have to go for the booking serum test, and then we have to check for its low avidity means, then it is a risk. Then we have to start the valsiclovir, and we have to monitor the mother liver function test serially.
yes,
And then if it is if it is low avidity, then we have to do the CMV, sorry, amniocentesis in the fetal medicine unit. And then if she is blood group negative, that's why we have to give the anti-D.
I'll make it
And
simple for you. Like, I'll first finish up with the feedback and then I'll make it simple for you. Okay.
okay.
So, Dr. Ranjita, it was a very good presentation because there is nothing significant that you have missed because your history taking was up to the point. You asked regarding the only thing is like in the information gathering, the consultant was away.
Oh, okay. Sorry, I didn't.
So we have to address that as well.
Hmm.
Apologize for the consultant's absence. So whenever you see that the consultant is away with some vacations or emergency in the task, don't just stop your sentence with, my consultant is away. Is it okay if I proceed with the consultation? Say that you will arrange a follow-up meeting with the consultant. That will seem even pleasing. Okay, my consultant is away because of an emergency. I'm so sorry for that. Is that okay if I proceed with the consultation and later on I'll arrange a follow-up meeting with him? Okay?
Yes, ma'am.
And then coming to the history, you confirm the patient's name and identity, you establish the aim and agenda, you asked her concerns and expectations. And in the information gathering, you asked about the exposure and the CME specific symptoms. You kept reassuring her throughout. Your tone and empathy was good. And rest of the routine history like personal history, past, surgery, allergies, BMI, blood group, mental history was very well done. And remember, whenever the patient says negative blood group, always keep it a point to talk about it immediately. If at all we are doing any procedures, because in this task we may have to do her amniocentesis, right? So in
Yes.
case if we are doing you any procedures during the pregnancy or within 3 days after the delivery, we are going to offer you anti-D. So in that way, if you cover this point with the blood group itself, you won't be missing on any patient safety thing. Because without addressing anti-D, the entire task, even if you have done well, it becomes borderline in patient safety. Okay, so always try to address it in the information gathering when you're asking about the blood group itself. And throughout the presentation, you were using non-verbal cues, you are not using okay and all significantly, so it was a good practice. And in the family history also, we have asked any concerns in the family. Also, we can ask, is there any other children or pregnant lady at home? Because if there is any child or pregnant lady at home, we have to ask her to keep at distance, okay?
Yes, ma'am.
And coming to the explanation part, your explanation part was good. You offered if she needs someone to be with her. And then you started to proceed with the explanation of the report. What is IgM, about the avidity test? You spoke about amniocentesis. You involved the communication with colleagues, especially fetal medicine center. And you spoke about the implications. And you also told about the valacyclovir and that, how it is helpful, that it decreases the transmission rates. And yeah, so whenever I say that I'm stressed or I'm being anxious, use that same line. I can see that you're anxious. I'll put you in touch with your counselors for your mental well-being. So whenever she says she is anxious, put her in touch with a counselor. Okay.
Yes, ma'am.
And one more thing, instead of seizures, you can say fits. Baby can have fits, because seizures can be a medical jargon sometimes.
Okay.
Okay. And yes. And one more thing. So that's all up for the feedback. So your information gathering, communication with colleagues was good, and it was a clear pass. And patient safety becomes borderline. And applied clinical knowledge, there are few more things which we can address that I'll tell you now. But you have
Sure.
done very well for a surprise task.
Thank you, ma'am.
And regarding the pregnancy also, you addressed well that we need to take 1 year gap and the breastfeeding is safe. Those questions also you have answered very well. So coming to this task, yes, Dr. Srilata, whatever you have told are absolutely right. They're as per the flow chart which was given in the latest talk. So here, what are the important piece of information we need to get from the task? Patient's name and identity, how many weeks into her pregnancy, the consultant is away, and they have given one blood test. Here, I have mentioned only IgM is positive. Usually, if you can see in that flow chart, there will be IgM and IgG. Both of the antibiotics will be mentioned, right? So here we are discussing about a woman who is less than 24 weeks of gestation. So in the CMV task, you need to remember only few things in the information gathering, in the investigations, and in the treatment part. So the information gathering is simple. You just have to remember about the symptoms of CMV, how about her exposure, and the family history. Just these three things you have to remember. In the symptoms of CMV, ask about, so if at all you are having an antenatal task, in any antenatal task, in the information gathering, what do we ask? Any history regarding to particular scenario. For example, if it is a diabetes related questions, CMV related questions. Then in short about the pregnancy. Dr. Ranjita, you have asked if there are any complications in the pregnancy. Along with that, you also can ask if all the scans and booking blood tests were normal or not. Okay. I think you
Yes,
have
ma'am.
asked that also. So after that, CMV specific symptoms, only few things you can remember. Fever, body aches and muscle aches. Sorry, joint pains and muscle aches. These three symptoms you can remember. And regarding the exposure, when and where the exposure has occurred. If you ask about it, she'll only reveal the entire thing, that she's a school teacher or she might have contracted from some other person at home. She will give a history. And one more important question is there anyone at your home who are at risk? That is, any pregnant ladies or children, because it also becomes a patient safety. Is that clear? So these are the few things in the history. Apart from routine history, apart from the routine pregnancy details and the obstetric history, mental history obviously will ask for every antenatal patient. Ask about fever, joint pains, muscle pains. If you remember, ask about swelling around the neck. And regarding the exposure, when and where the exposure has occurred, and any previous CMV infections. And in the family history, not just any family history of concerns, also ask if there are any children and other pregnant ladies at home. This is just about the information gathering, only three things you have to remember. And it is a big news for the patient. This is obviously not a good news, and there is a lot of things we need to discuss with the patient. So always offer if she needs someone to be with her. Now coming to the blood test. Usually they'll give either one test, or most of the times they'll give two tests combined, like about the IgM and IgG. First, interpret the reports. There is only one flow chart which you have to remember in this particular task. Only if both of them are positive, you are worried, right? So in this flow chart, only if IgM and IgG both are positive, you will do the further workup. If both are negative, nothing to worry. If IgG alone is positive, it indicates a past infection. But in this task, I have given IgM alone is positive. So what do we have to say to the patient? So there are certain antibodies which are nothing but the proteins produced to protect us from infections. There are two types, IgM and IgG. Tell her what is IgM and tell her what is IgG. In the blood test, I have verified the name and NHS number. It shows that this IgM is positive. It seems that you might have an infection. Use the term might because we are not yet confirmed. But in order to confirm it, we need to do further testing. That is, we have to do this IgG and also the avidity testing, not just the avidity testing. Okay. If they have given both of them, you can simply say avidity testing. Otherwise, say IgG avidity and IgG. Is that clear till now?
Yes, ma'am.
So we have to do two blood tests. Remember, only two blood tests. Whatever permutation, they'll obviously give either IgM positive or both IgM and IgG positive. Because for other three different scenarios, we don't have to worry about and you don't have anything to talk about. So only they'll give either IgM positive or both IgM and IgG are positive. Remember, the next step would be IgG and IgG avidity test. We'll do this special test, and if these tests are positive, usually low avidity will be significant. If these tests are positive, we'll start you on a medicine called valacyclovir, as you have rightly said. Okay, so the investigations are just to IgG and avidity, and after that coming to the treatment, here also you need to remember three things. One is the medicine, next is the amniocentesis, and the other thing is about the serial scans. In the treatment also just the three things in this order: medicines, amniocentesis, and the scans. In the medicine, once the infection is confirmed, we are going to start you on a antiviral medication called as valacyclovir. The dosage is usually 8 grams per day. Even if you don't remember, that's fine. So in the drug therapy, we'll be starting on valacyclovir. And how long you are going to give her valacyclovir? And when are we going to do amniocentesis? Amniocentesis is usually planned around 21 to 27 weeks, 22 weeks, right? So we'll be giving you this medicine until a procedure called amniocentesis. In this amniocentesis, a fluid around the baby will be taken and will be sent for testing. So whenever you talk about amniocentesis, say it will be done under aseptic precautions by a special scan doctor called a fetal medicine expert. And under aseptic precautions, and after the procedure, we'll be giving you anti-D. Okay? If the amniocentesis is positive, we'll continue with the medication. If it is negative, we'll stop the medication and we'll review the baby after birth. Is it clear so far? Or do you want to repeat anything? So this is up till the amniocentesis. So what do we do if the amniocentesis is positive? What is the next line of management?
We continue valcyclovir and do anomalies scan and
MRI scan at between 28 and 32 weeks. We have to do brain MRI scan.
Yes.
And after delivery of the baby, we have to check for any neonatal PCR test we have to do. And then we have to start the valcyclovir for the baby. It decrease the deafness and it does not cause the deafness. That's why you have to start immediately.
Yes. We'll be going.
And then breast milk pasteurization is also will be done. And that baby will secrete the virus in the urine and as well as the saliva. That's why
we'll finish up with the
okay. Okay.
So after amniocentesis, what we'll do, if it is negative, we'll stop the medication and baby will be tested. If it is positive, simply say we'll do serial monitoring of the scans. If needed, we may have to do an MRI also. If there is any inconclusive scan findings only, we'll be doing MRI, right? So we can simply say we'll be doing serial monitoring of the scans, and if needed, we may have to do MRI. And now here you tell her, if the amniocentesis is positive, you also have an option of ending the pregnancy because the scan findings can take up to 12 weeks to appear. Even if you don't remember the exact number or the percentages, you can simply say it will take time for the scan findings to appear, so we can offer you terminating the pregnancy also. Is it clear? So just 3 questions in
Yes.
information gathering, 2 investigations, IgM, IgG, and avidity testing. And you don't have to explain the patient in detail what if IgM is positive, IgG, low avidity, and how much percentage of avidity, and how all those things you don't have to explain to the patient because it will confuse the role player and you yourself will confused. But you read all of that and keep it ready in case if it comes as a structured discussion. But for the simulated patient task, just you have to touch and go everywhere. You don't have to go in depth you don't have to explain the patient in depth about each and everything. Okay. And coming to the treatment,
Okay.
one medicine, amniocentesis, and scans. Just remember these 3. We'll be giving you medicine. What is the advantage of medicine? It won't prevent CMV, but it will decrease the risk of transmission to the baby. That is the advantage.
Around 70%.
Around 70%. That is the advantage of medicine. Remember that. And whenever you are telling amniocentesis, not just in this particular task, either in early pregnancy or whatever module, always say it is done by a fetal medicine expert under aseptic precautions. And if it is a negative blood group, don't forget about the anti-D.
Okay.
If it is positive, serial USG and MRI. Don't say like how, and then in the flowchart, there is a big thing like what is mildly affected, moderately affected, severely affected. Don't tell all those things to the patient. It will confuse her. You simply say, you have an option of ending the pregnancy if the baby is severely affected. That's all. And now, after finishing the treatment, how are you going to take care of the baby? So for the baby also, you'll be doing investigations and treatment, right? So what are the investigations? As Dr. Srilita has told, yes, we are going to do investigations with urine and saliva. And how are we going to treat her? The baby is going to be
Placenta examination also we'll do now. Placenta examination also we'll do. If it is baby affected.
Yes. Placental examination also will be done. So baby will be tested for CMV with saliva or urine after birth within 3 weeks. And if the baby is affected, we are going to start her on valganciclovir. The medicine for the mother is valacyclovir and the medicine for the baby is valganciclovir. That is 8 grams per day. This is 6 milligrams per kg. So the medicines are different. That is valacyclovir and this is valganciclovir. If it is not orally tolerable, we can give an IV form of the medicine also. When do you have to give these medicines? It has to be given within 1 month. Because the advantage of this medicine is it will improve the neurological outcomes of the baby and also decreases sensorineural hearing loss. And all these things given for 6 months and follow up for 5 years, these are for additional information. If you want to remember, you can. Otherwise, you can just remember the medicines and when do you have to give the medicine. This alone is important. The highlighted things alone are important. So this is about the baby care, investigations and treatment. So what about postpartum care? She might ask you, is the breastfeeding is safe? Yes, you can give breastfeeding for up to 6 months. Don't say breastfeeding is completely safe. You can, something like that. Never use those kind of words in RCOG exam because always it is like risk versus benefit. So you can give the breastfeeding, it is safe. And about the pregnancy, yes, we have to avoid planning if the baby is affected, you have to avoid pregnancy for another 1 year. Why is it so? The mother continues to shed the virus. That's why we give a time of 1 year. Is that clear?
Yes. Hand hygiene is important.
Yes. So in the postpartum care, you just have to remember 2 things, 1 year gap and about the breastfeeding. This is obviously we'll tell for every antenatal patient about the breastfeeding and the next pregnancy. And another important is avoid close contact with young kids and other pregnant lady and maintain hand hygiene. This is an important patient safety thing. Is it clear?
Yes.
Do you want me to summarize, or like any of any of you can tell me about 3 important things in the information gathering for this task, only in the information gathering? Just 3 things in the information gathering which is particular to CMV. Okay, the information gathering, you need to ask about CMV symptoms, fever, malaise, or joint pains, and the muscle aches, exposure details, and previous CMV infection. These are the 3 things which you have to remember here. And also at home, if there are any children or young other pregnant ladies. And investigations.
Investigation, so how to do the IgG, IgM, we have to, and then go for the IgG and then avidity test.
Yes, low avidity is significant. Low avidity
If
indicates
low avidity is significant, and then you have to, if low avidity positive means, then you have to go for the fetal medicine specialist, will do the amniocentesis at 21 to 22 weeks.
And also, I forgot to tell you, like in the investigations, if both IgM and IgG are positive, this avidity testing will be, booking sample also has to be checked. The
Booking sample, you have to check it. If it is high avidity means no problem.
No problem. Low avidity is significant here. And
That
regarding
is a post-conceptional infection, correct?
So what do we have? Why do I have to do booking sample? Is we don't have to explain to the patient also why we are going booking sample. Just utter the name that we'll be doing a booking serum sample, and then low avidity testing. Avidity testing, sorry.
This is in your test. This is a recent proteins came positive. That's why you have to do the confirmatory proteins. If it is that is also positive, then you will go for the avidity test.
Yes. And regarding so once the infection is confirmed, what is the flow chart we are going to follow, Dr. Ranjita? Or
Yes, ma'am.
anyone else can like attempt, like what is the protocol we are going to follow once the infection is confirmed? Valcyclovir, amniocentesis, and the scans. Okay. So, and regarding the baby?
Regarding the baby, if it is a positive means we have to test the after birth testing and baby testing, and then we have to start the other tests also like CBP and liver function test also we will do, and then we have to start the valganciclovir either in the oral form or maybe injection form.
Yes. Yeah, and if amniocentesis is positive, we have to give the option of termination for the baby.
Termination also. Yes.
And for the baby, investigations and treatment, postnatal care, remember about breastfeeding and
hand hygiene.
Hand hygiene.
And next pregnancy. About the next pregnancy.
Next pregnancy, yes. Any doubts till now?
Yeah, I think Dr. Lakshmi has told about the options of termination in case if the patient wants or it is severely affected.
Yeah. And about the
you tell Dr. Lakshmi.
Yeah, and about the maternal fetal risk, we can simply say that there are like lot of risks which can occur to the mother and the baby with CMV. There is a big tabular column given in the talk as well. You can simply remember sensorineural hearing loss is the most important complication which can occur with CMV. So you can say it can affect the baby's hearing, and it can also lead to problems in the baby's brain, that is like neurodevelopmental problems, and IUGR. Remember these three things because it causes a lot of things like microcephaly, hepatomegaly, splenomegaly. So even if you don't remember any of those things, remember the hearing loss, neurodevelopmental abnormalities, and IUGR babies. These three things you remember. Okay.
And also, one more thing is like it is one of the most common cause of non-genetic sensorineural deafness, hearing loss. And a few say patient safety points that you have to utter in case if any high risk group like any women with the toddlers or if the woman herself is a child care worker, then you have to tell those safety points because if in her case she is a teacher, so we have to tell like avoid exposure to the toddler secretions and wash hands after once the baby is born. Wash hands after changing the nappies and avoid sharing of utensils and cups because it can be secreted through saliva and urine. Now avoid kissing the young children with mouth and use clean toys and surfaces.
Yeah, patient safety, this hand hygiene is important because even we might think it is a very simple point, but it has an important role. So don't forget to mention about hand hygiene in the task.
Yes, that is a very important patient safety point.
Yeah. So
And also there is one more, if in case if it is more than 24 weeks, that flow chart
is
is
it
also,
like,
can you just share, doctor?
is the before 24 weeks, is it clear for anyone or do you have any other doubts in this particular thing? I tried to simplify it so that it will be easy because this entire flowchart looks
More complicated.
complicated and confusing. Do any of you have any doubts in less than 24 weeks? Or shall we proceed with greater than 24 weeks?
Yes, can you just share the more than 24 weeks also, doctor?
Yes, it's here.
Yes, in more than 24 weeks, it's nothing but in the less than 24 weeks, we will be giving the treatment options because the treatment will reduce the risk of transmission of the infection. So that is why we are giving the vancomycin treatment or any treatment options. Whereas in more than 24 weeks, that randomized control trial shows no such benefit. So what they are going to do, they will be doing all the same test as how it has been done in the less than 24 weeks. But one and only thing is like they will be doing an fetal medicine referral for a targeted ultrasound. In this, if it is a normal ultrasound, they will just follow up every 4 weeks and offer neonatal CMV PCR. If it is an abnormal ultrasound, then they will be doing an maternal serology. They will look for whether it is a negative IgM and IgG. If it is both are negative, then CMV is excluded. We have to rule out other causes. If they are positive, then we have to label that baby as a high risk for congenital CMV, and we have to offer amniocentesis. Is that clear? Hi dears, can anyone acknowledge? Yeah, one and only thing is that we will be offering the treatment options. Dr. Lakshmi, can you just show that less than 24 weeks table as well? Yes, if you see in this case, maternal treatment with the valacyclovir is given to reduce the risk of vertical transmission. So we have to start the treatment and do an amniocentesis. Once the amniocentesis results are out, if it is a negative amniocentesis, we can discontinue treatment. If it is a positive amniocentesis, we will be giving the treatment. Whereas in the gestation more than 24 weeks, doctor, can you just show the next more than 24 weeks chart? Yeah, in this we are not starting the treatment because after 24 weeks there is the treatment does not show any such improvement in reducing the risk of transmission. So just we will go ahead with the fetal medicine referral for the targeted ultrasound, and uh, and and also we won't offer the amniocentesis also. And in the ultrasound, if it is a normal ultrasound, we will just follow up. If it is an abnormal ultrasound, then we will check into the maternal serology. If they are negative, nothing. If they are positive, then only we will offer amniocentesis. Am I clear here? Yes. Thanks for acknowledging, because yeah, we thought that this task will be a bit complicated, so we thought we will just highlight the important thing alone.
Ma'am, we will offer ultrasound scan of only when IgM and IgG is positive, right? After 24 weeks.
Yes. IgM and IgG positive, we will be doing a retrospective serology of the booking bloods. And if both are positive and with high avidity means it is an pre-conception CMV infection. So we have to reassure just to do an neonatal CMV testing. If it is both are negative, or if both are positive but low avidity, or if IgM is negative and IgG positive, then we will be doing a fetal medicine referral for the ultrasound. In this ultrasound, if it is an abnormal ultrasound means, then we will be doing an we will be looking into the index sample. If the index sample both are negative, then CMV infection is ruled out. Got the point here? But if they are positive, means high risk of congenital infection. Then only we will be offering amniocentesis. Whereas if you see less than 24 weeks, we will be starting the treatment and offering the amniocentesis. We will discontinue the treatment only if it is a negative amniocentesis.
Because beyond 24 weeks, there is no point of amniocentesis. We cannot do amniocentesis. So we'll directly go for targeted scans.
Targeted ultrasound.
Whereas
Yes.
less than 24 weeks, we have various options. So just remember this particular thing alone, just the treatment, amniocentesis, and the scans for an SPT. This much is enough. And also in the investigations, don't forget about the booking sample either in less than 24 weeks or after 24 weeks. Try to go through the task once after the meet so that you'll remember it for you'll be able to get it better. And also remember these few things. If it is less than 24 weeks, these are some like 10 points which you can remember for easily attempting an SPT.